Lipedema is estimated to affect between 9 and 11% of women worldwide. That's millions of women all over the world who are often misdiagnosed as having obesity or lymphedema. This is a condition which is not taught in medical school or to clinical nutritionists. It's not taught in health science degrees. It's relatively unknown, and considering the worldwide extent and impact to women's health that this has, we are wanting to raise awareness, and we are making significant progress in doing that because this really can help to improve the lives, the quality of life for women who have this disorder. It's a loose connective tissue disorder, also known as a fat disorder, that needs a different treatment. It has different causes and it needs different treatment to that of obesity and lymphedema. It can also include those conditions, so you can have lipedema, lymphedema and obesity, but not necessarily all three. It could just be lipedema on its own. So today I just wanted to run you through what is lipedema without going into too much detail, but also talking about a ketogenic nutrition treatment or lifestyle for women who have this condition, and just how well that can help to manage it. So I'll also give you a couple of case studies to look at so that you can see a couple of women who have had significant success with utilizing a ketogenic lifestyle to help them to improve their quality of life for women with lipedema. So I'll just share my screen with you, and we'll begin. So lipedema, as I have already mentioned, affects so many women. I myself have lipedema. So I'm a clinical nutritionist. I'm the founder of I Choose Health, which is an online international health clinic providing education, support and consulting to women with lipedema. I have a membership group, an online course, and also one-on-one nutrition consults. So I have stage 2 lipedema myself that I manage well through a ketogenic lifestyle. I'm a stage 2 breast cancer survivor. I've had a double mastectomy. I've had chemotherapy treatment. I've had quite a lot of health challenges myself. So I really understand from both a clinical but also a personal perspective of how lipedema can affect life and lifestyle. I've helped hundreds of women worldwide with lipedema and with lipolymphedema, which is when those two conditions coexist. I'm the co-author of a peer-reviewed article that was published in Medical Hypotheses called The Ketogenic Diet as a Potential Intervention for Lipedema. You can check that out online. We paid for that to be included so that it could be provided for free. So you can look that up and download that at any time. And in the past, I have been on the medical board, advisory board for a US lipedema organization. I am the co-author of a ebook that is coming out soon with US endocrinologist Dr. Karen Herbst, and I'm also lead author of a lipedema cookbook. So today I'm going to talk to you about the main goals for a conservative approach to lipedema. We're going to look at some peer-reviewed research. We're also going to discuss the benefits of a ketogenic lifestyle for lipedema, lymphedema and lipolymphedema. I'm going to provide an understanding of the key dietary issues, and we'll have a look at a couple of case studies. So the goals of conservative intervention for lipedema are important to understand because left untreated, lipedema has painful, life-changing symptoms. So it's so important that we get it right. The main aim, of course, is to avoid surgery, or if you choose to have surgery, to seek optimal health to prepare for surgery. Most women, if there is excess weight involved, will be asked to lose weight prior to surgery. So this is following a ketogenic lifestyle can be a great way to do that, to make surgery less of a risk. But we really want to reduce or ameliorate symptoms if we can. So just stopping the progression of lipedema is in itself a primary goal. And anything beyond that, if there is weight loss beyond that, improving metabolic health, all of those things are what we are searching for as well. But just stopping that progression in itself can really reduce the risk of getting further complications. So that's something we want to be focusing on. We also, of course, do want to halt or even reverse that progression. So what we know about lipedema is that it is abnormal adipose tissue, excessively deposited adipose tissue. So the fat cells become enlarged, they become irregular shaped, they can become diseased themselves. So they can have excess sodium and fluid components, making them very spongy. We know there can be leaky capillaries and leaky lymphatics. There can be chronic edema. There can be there is a lot of inflammation. When you have diseased fat cells or fat cells that are enlarged beyond where they should be, there is a lot of inflammation. So that's going to be one of the key things we need to target with an approach for helping women with this condition. There is also metabolic and hormonal dysfunction. Not always metabolic dysfunction, but it is quite common, and especially as the disease progresses, then we are certainly look at metabolic dysfunction. Type 2 diabetes, for example, may be much slower to become involved, but it does become involved. So you may see pre-diabetes, where typically at that age and weight you may see type 2 diabetes, full-blown type 2 diabetes. Not everyone has the hormonal and metabolic dysfunction, but it is very common. And that will, of course, depend on whether you have, excess weight gain other than the lipedema weight. So you'll typically see that disproportionate weight gain with lipedema, where mostly that what we call gynoid weight gain, which is in the hips, thighs, and buttocks. But also in the upper arms, you can have lipedema there, and in a lot of places on the body that isn't typically reported in the literature, but is becoming evidenced that lipedema fat cells can be in many areas on the body, but they are typically in that gynoid distribution area. The back of the thighs in particular seem to be very common. So pain is a very common thing for women. Not everyone with lipedema will experience pain in their lipedema area. Some people just experience pain to touch. So for some women, it can be extreme pain at all times. For other women, it might just be when someone touches your thighs, for example. It's something that I experienced when my thighs were touched. That's when I would experience the pain. But the pain is significant for many women. And one of the things that we love about a ketogenic approach is that it can help to resolve that pain for some people very quickly. Cell hypoxia, necrosis, and fibrosis is a big part of lipedema as well, particularly as things progress, which is why we want to stop progression. So hypoxia is where the cells are cut off from their oxygen supply, and necrosis is cell death. So that causes problems as well, because the intracellular contents of the fat cells can spill into the extracellular environment and create excessive proteins in that extracellular environment and other toxic and pro-inflammatory substances. So we really want to, again, halt progression so that we can ease that inflammation, ease the fat cells expanding too large, where you then get into that state of hypoxia and necrosis. And when inflammation is chronic and ongoing over time, it does develop into fibrosis. So these things can really impact mobility for women with lipedema, where it starts becoming difficult to walk. It becomes difficult to be able to get out of chairs. It becomes painful to sleep at night. All of these things impact quality of life, lead to things like chronic stress, impact quality of sleep. And those things are also huge problems and can lead into metabolic health issues. If you've got chronic stress and you're not sleeping well, you're going to create things like insulin resistance, which is going to dysregulate your blood sugars and make it very difficult to lose weight. So it has huge impacts across all areas, because of course good health is not just about good food. You have to be balancing all lifestyle areas. We already spoke about chronic edema becoming an issue. Some women will have orthostatic edema, which is standing for long periods or even sitting for long periods can create that excess fluid within the limbs. So within usually the legs, it can also be the arms. And resting or putting your legs up will help with that edema. And lipolymphoedema for people who are morbidly obese can be a problem where the lymphatic system actually becomes damaged, and that of course leads to a whole lot of other issues as well. So I co-authored, as I mentioned earlier, a paper for a modified ketogenic lifestyle for lipedema. We proposed or hypothesized that some women with lipedema may need to go lower carb than others to be able to get into nutritional ketosis for some, depending on metabolic health, but also that some may respond better. And we think that lipedema fat cells may actually respond the lower you get your carbohydrates, that you may be able to actually access some of that the lipedema fat. So that obviously needs to be looked at in clinical trials, so that will be really exciting to see. But we do know that women can reverse their lipedema stages. Clinically and anecdotally, we know that and we see that. I've experienced that myself. We don't, of course, we're not at the stage where we have biopsies to actually look and monitor that at that type of level. So that's what we really look forward to more studies being able to show that. But we certainly know that there are other benefits from a ketogenic lifestyle for women with lipedema, and that is things like lipedema adiposity is resistant to weight loss diets, but may respond to ketosis. So typical calorie restricted diets alone isn't enough to be able to lose weight from the lipedema fat cells, the fat cells that are diseased. And however, ketosis may be what helps those cells to respond. Ketogenic diets modulate pain in lipedema independent of weight loss. And this is really key as well. So not everyone needs weight loss, but the ketogenic diet can help to modulate that pain. And as mentioned earlier, for some women that can be very quickly, and some women it can be having to avoid going on to very strong pain medications, because this way of life actually helps to reduce that pain. So it's a natural conservative approach. Ketogenesis positively impacts lymph vessel integrity and lymph transport, which is also key for women who are having trouble with their lymphatics. And the release of beta-hydroxybutyrate reduces inflammation, and this is a big one because inflammation is really the driving force behind not only lipedema but many chronic diseases these days. It's a huge global problem. So beta-hydroxybutyrate is the main ketone that's supplied or produced in ketosis, and it has many health benefits, one of them being that women with lipedema have really significantly improved pain. The lipedema adipocytes or fat cells may require lower levels of insulin than other adipocytes for lipolysis to occur. So the breakdown of fat from those cells, for that to occur, we hypothesize that some cells may need even lower levels of insulin to be able to do that, and hence where we say that some people may require lower levels of carbohydrates than others. So this was a study looking at the potential effects of a modified Mediterranean diet on body composition in lipedema. I'd like to have a look at this because A lot of people will say, well, a Mediterranean diet can be great for lipedema as well. Any anti-inflammatory diet can be great for lipedema as well. However, I find that sometimes these Mediterranean diets aren't actually aren't targeting the fact that the carbohydrates are a problem. So you can have an anti-inflammatory Mediterranean diet that will have healthy fats included, which is terrific. So does a ketogenic diet. It will have moderate amounts of protein, fantastic. So does a ketogenic diet. But it will still allow fruits and higher carb vegetables. Sometimes it allows pasta. You're not able to necessarily lower insulin in the same way that a ketogenic diet does. So some people will find improvements following either of those, and that's great because, as we said, it really is about stopping progression, and if you can do that via either one of those, that's terrific. The Mediterranean diet is going to be different. For this particular one, it was a study with 29 people. They calorie restricted people for 4 weeks. They had a control group, and both groups significantly, the control group meaning who weren't following a calorie restricted diet, both groups did significantly decrease their weight and their body mass index. And the possibility for lippy subjects to perform simple daily activities with less fatigue, pain and anxiety was also highlighted, which is fantastic. In both groups, the weight and their BMI were significantly decreased after 4 weeks on the Mediterranean diet. In the control group, weight loss was reflected in reduction of all body composition parameters and related circumferences, but after the Mediterranean diet, lippy patients showed only a decrease of fat mass in upper and lower limbs and a decrease of lean mass in the legs, which is great. That's what we want with women with lipedema. But my take on that is that it's great to reduce the arm and leg size. However, the muscle loss occurred, which is not ideal, and ketogenic diets help to prevent that sarcopenia or that loss of muscle mass. And the waist circumference, and therefore the cardiovascular and metabolic health risks, were not improved. So there wasn't weight loss from the waist, and we know that carrying weight around your midsection really is part of that metabolic syndrome, and an increased waist size is an independent risk factor for cardiovascular disease. So that's that's another reason why I like the ketogenic diet, that we know does decrease those areas, and does and we can tell from blood test results that it and long-term studies that it does decrease metabolic health factors, and we can see that inflammation decreases. There are studies that show sleep improves. The triglyceride to HDL cholesterol ratios improve. Blood sugars and insulin improve. So they're really the factors that I'm looking for in a lifestyle to help treat not only my health and with lipedema, but those of my clients in clinic. So the anti-inflammatory effects of a ketogenic diet that we touched on, improving mitochondrial function. The mitochondria are the powerhouses of our cells. They are what help produce cellular energy. We need to improve that and reduce oxidative stress in the cells for optimal health. And we need to interrupt the inflammatory pathway, which ketone bodies do. So with a ketogenic diet, it's a shift from that what we call glucocentric to adipocentric, which is great because it's really changing when you're changing your body relying on glucose and needing a constant source of glucose to keep your blood sugars regulated. That's what we call a lipolytic environment, or the ability to actually break down fat cells. Comes with a reduced risk of the sarcopenia, or that loss of muscle mass, which is really important for women with lipedema, because often people with obesity will have an increased muscle mass from carrying around the extra weight. It helps to you need more muscles to be able to carry that extra weight around. But women with lipedema don't tend to have that increased muscle mass. So it's very important then that we are further protecting that when we're looking for a lifestyle dietary intervention. Improved insulin and glucagon sensitivity, again, is very important, and we touched on that already, that improvement in cardiovascular and metabolic risk factors. Reduction in adipocyte size, or the fat cell size, and reduction in plasma insulin and leptin, triglycerides and LDL cholesterol ratios, which we know are really important for overall health. And hunger and satiety as well. Increased adiponectin, which is a really important hormone, anti-inflammatory hormone, which can reduce. We want that to increase, so that's another benefit, as well as improved satiety and improved HDL cholesterol. So there was a study. Researchers are suggesting that that one of the mechanisms for reduced pain in a ketogenic diet can come from mechanisms that are similar to that controls seizures. Animal studies show a reduction in sensitivity to thermal pain, mechanical pain, and or neuropathy after several weeks on a ketogenic diet. There was some researchers who hypothesized that carbohydrate restriction reduces excitability of neurons, which can suppress the perception of pain, block glycolysis and reduce inflammation, and increase levels of adenosine, a natural analgesic. And also studies show that reductions in osteoarthritic knee pain in older subjects on a low-carb diet with similar weight loss to low-fat diet. Authors suggest oxidative stress and therefore increased pain and inflammation from high carbohydrate consumption compared to lower levels in study groups consuming low carbohydrate diets. So there was a Norwegian 7-week clinical trial of women with lipedema that showed significant decreases in the levels of pain, but those levels of pain actually returned to baseline, or returned to where they started at, after reverting to 6 weeks of a standard Norwegian diet. So despite the maintenance of weight loss. So I think that is such a significant outcome in this small but significant trial, that shows that it was the dietary approach itself, not the weight loss, that brought about that reduction in pain for women with lipedema. Clinical experience and various online support groups demonstrate that profound reduction of lipedema pain with as little as 3 days, and sometimes less, with carbohydrate restriction. So we hypothesize that pain in lipedema is largely due to inflammation, which is curtailed under a ketogenic diet and may be completely independent of any weight loss. So relying on solely calorie restriction diets doesn't work, and this is something that we really, really need to emphasize, because still I have so many women coming to my clinic who are being told to eat less, to calorie restrict. I have so many clients who I have to help repair their metabolism by increasing their food intake, because their medical professionals or their medical support team aren't believing them that they're not overeating because of the size of their bodies. And that really, I think, is demonstrating the lack of understanding of hormonal and genetic dysregulation, of altered metabolisms, of how calorie restriction doesn't work, of how hormonal disbalances can impact weight gain despite the amount that you're eating. So you can still be gaining weight on fewer calories if you're eating the wrong types of foods that aren't supporting where your hormones balance is like. So, calorie restriction alone slows your metabolism. If you're not taking in the calories your body needs to work optimally, your body is going to slow your metabolism so that it doesn't burn as many calories. The body eventually will upregulate hunger. It doesn't like to be deprived of calories for long periods of time. It sees that as deprivation. It can also see that as starvation. So it will upregulate hormones to make you seek food, to make you eat, pretty much. So it will drive carbohydrate cravings and food cravings and overeating to try to reset its weight, that weight point of before you started calorie restricting. So the body wants to restore those fat levels before that calorie restriction. Calorie restricted diets don't address insulin resistance and inflammation. And also it doesn't address emotional eating, stress and poor sleep habits. There is so much more to improved health than just the food that you're having. It doesn't address, calorie restricted diets don't address food addiction, but also if you're not tolerating carbohydrates well, and these days we're told to be eating carbohydrates for breakfast, lunch and dinner and 2 snacks in between. We're just constantly spiking our blood sugars and insulin, and this is really problematic. And so if you're, for a lot of people, they're not tolerating that well, and it causes rapid weight gain, but it can cause many other health problems. And a lot of modern diseases we now are seeing are being driven from this instruction to be eating so many carbohydrates. And for a lot of people, and I would include myself, that I don't tolerate carbohydrates well. If I start eating them, I find it hard to stop. I like to eat well. I eat well, most of the time. And if I start eating carbohydrates, I find them difficult to stop. So I don't tolerate them well, and it affects my blood sugars too greatly and my insulin too greatly, and it causes swelling, it causes pain, it causes weight gain, so and fluid irregularity. So calorie restricting is not going to help all of those things if the calorie restricted diet still contains the carbohydrates that are contributing to the inflammation, to the higher insulin, to that metabolic and hormone dysfunction. That's what you need to be addressing. You don't need to calorie restrict to have the benefits of addressing those things. It's more about what types of foods you're eating. It's so important. And if you are just simply calorie restricting, what happens, you can't sustain calorie restriction forever, particularly for women who are wanting to become pregnant. Your body is not going to prioritize the reproductive system and maintaining the reproductive system health if you're calorie restricting. It can't do that. It doesn't have the calories or the energy to be able to do that. So, the body will eventually do the rebound weight gain, where you'll normally put the weight back on, if not more than where you originally started. So a ketogenic way of eating is different. It has that focus on reducing insulin and inflammation and weight. The ketogenic diet is a lifestyle, so it's something that you can sustain ongoing, and that's important. You can't sustain severe calorie restriction ongoing for life, but a ketogenic way of eating you can. And a lot of people panic to think that oh my God, I can't eat carbohydrates for the rest of my life. That's that type of approach, catastrophic thinking, really, to think of it that way. And it can be really overwhelming, and it's not the right approach to doing this. So you need to do it incrementally. You need to sort of take that on first and adopt it for 6 to 8 weeks in the period where you fat adapt. And then when you're starting to feel better, it then becomes something, I think, that's better to work with a health professional, to make it a healthy way to do, to incorporate. You need to be protecting electrolytes, and different people will need different things for that. And you need to be medically monitored while you do that. So I really do believe the healthy way to do that is to do it with someone who knows, who understands metabolic health, who can help you look at blood test results and monitor blood test results to make sure that your body is going okay with it. I have tons of people who say, I'm doing a ketogenic diet, I've tried it, it's not for me, it didn't work. And not everyone is going to be suited and enjoy this lifestyle, but I really think that that's impacted by how well you implement it. How well you make sure that you're including the right things. Do you know about the combining proteins and fats? Do you know how much protein is optimal to be getting what you need to be to be getting? Do you know how to use fat for satiety and for weight loss? That's going to differ for everyone depending on what your goals are. And, different amounts of carbs and different foods. And some people can have intolerances, food intolerances, depending on your gut health. It's going to impact that as well. There are thyroid considerations to take into account. There may be medications that can impact how well you're responding to ketosis. Are you even in ketosis? Are you monitoring that you're in ketosis? Do you know how to do that? I've had a lot of people come to me thinking they've been doing keto. When we measure, they're actually not in ketosis. Things like that. There's just so many different things that can impact it. But keto also teaches listening to body cues and signals. For some people, this will be really difficult to do to start with, and it takes, I think, some retraining to get there because we've been ignoring natural body cues for so long. Some people will have hormonal dysregulation that makes that difficult to do, but once health, hormonal balance and other metabolic health starts improving, that we can start to listen to our body's cues and signals again, rather than intellectualizing our approach to health and to weight loss, where we're simply calorie restricting and looking at the scales. It's just not a healthy approach, and it's not sustainable. And with keto, we teach you why there are better ways to monitor success, which will include blood test results, but include body measurements and things that actually tell a much more thorough picture. If you've done keto before and decided whether it was successful or not simply by weighing yourself on the scales, you've done yourself a great disservice. There are many women I have in clinic who will weigh themselves and see no change, but will also then look at their body measurements and may have released 3, 4 or 5 inches off their waist size, which is a huge health benefit, not only to how much you weigh and how your clothes fit, but more importantly by reducing an independent risk factor for cardiovascular disease, which is waist circumference. That also means that your cholesterol profile is likely improving, or lipid profile, the correct terminology for that. I hate to think of how many people have given up after simply using the scales. That old school thinking, or that calorie restricted diet, or low fat, outdated way of method of safely and healthily losing weight, simply because they haven't looked at other health improvements that to base their success on. Keto also helps to eliminate snacking, binging and all-day grazing, really important parts of being able to lower your insulin and lower inflammation and lower pain. Keto helps to promote the satiety and suppress hunger, and for some people that's key. For some people we actually need to promote hunger because they've reduced their metabolism so much that there are many people who don't experience hunger as they should anymore, and that can be due to nutritional deficiencies, calorie restriction, many different things. Just enjoying your food more. If you're going to improve your health, you need to find a dietary approach where you can love your food, where you're not starving and hungry all the time and feeling like you're missing out. And yes, there are some foods that we avoid over time. That actually becomes really easy when you see the health improvements and the symptoms improve. Then it becomes easier and easier to follow it. And these days there are so many amazing recipes for ketogenic foods, and that you really don't have to feel like you're missing out on anything. If you're wanting to change your health and you're wanting to take back control of your health, then they are easy, I think, swaps and food choices. But in a way that you can still really enjoy your food and eat plenty of food so that you're not feeling deprived. And of course, as I mentioned, that we can actually see improvements in metabolic and biometric markers, which is important. So a ketogenic diet, there was also a small pilot study done that looked at a ketogenic diet for lymphedema. and there were it was a small study, but it was significant. There were significant health improvements for lipedema as well. So that's another side of a ketogenic diet, a reason why we love that it can help with the lymphatic issues that people can have, chronic edema and lymphatic or lymphedema. So the ketogenic diet also was shown in another study to improve lymphatic vessel function and growth, and reduces the infiltration of anti-lymphangiogenic immune cells and decreasing edema. So, really pivotal information for women with lymphatic issues or edema issues. Ketogenic diets have also been shown to improve gut health. The microbiome, ketone bodies improving the microbiome, and this is also very important as well. Women with lipedema often will have gut issues, and that needs to be helped. So a dietary approach that can also help with that becomes important. So here's a case study one of a woman who started her journey with lipolymphoedema. So that triad of lipedema, obesity, and lymphedema, which you can see the lymphedema in her legs there with a lot of excess fluid. And she started at 321 pounds, which is 145 kilos. Her height is 5'4". Her BMI is 56, which is in the morbidly obese range. We don't often talk about BMI so much anymore. We often look at other things like waist to hips ratio, etc. But the BMI is something that we look at just to show overall, where the starting point is. Her pain levels were 8 out of 10. She was 59 years old. She had severely impaired mobility, often used a wheelchair. She had exertional asthma. She was unable to touch her feet. And she had, issues that are common for people with chronic lipedema, chronically progressed stage 3 or 4 lipedema, fungal infections, a lot of fibrosis, lobules and nodules within the skin, cellulitis, often getting cellulitis, which is a really chronic problem. She had been consulting with a non-keto dietitian for 3 years prior to seeing me. She had a 20 pound only or 9 kilo only weight loss throughout that 3 years. And her metabolic health markers weren't improving, importantly as well. So before the keto intervention, she had high blood pressure. She was medicated for high blood pressure, had depression. She had a heart attack in 2009. She'd had 3 stents inserted. She had suffered a pulmonary embolism or a lung clot. She was pre-diabetic, hyperinsulinemic, hypercholesterolemia. She was taking statin medications for high cholesterol, hypothyroidism, medicated for that, used a CPAP machine for sleep apnea, had small intestinal bacterial overgrowth, so that poor gut health and that overall gastrointestinal, chronic bacterial overgrowth in there, IBS and GERD for many, many years, the lipolymphoedema, and was taking a diuretic, and a history of childhood trauma, but 20 medications when she had started lipedema, the keto for her conditions. And now, of course, she's taking one prescription medication, which is a statin, which is just remarkable that, all of these factors, this is where you're measuring success of a dietary approach. All of these factors, and it's just incredible. So needless to say, she had weight loss as well, and I'll show you the before and after pictures of that shortly. But looking at triglyceride to HDL ratios, which are in your lipid or cholesterol profiles, seeing great improvement from that triglyceride to HDL ratio going down from 4.08 down to 1.51. Just incredible. And also, things like the A1C, which I believe that should actually be 6.4 started at, which is, just under the type 2 diabetic threshold. Taking that right down at this point, was showing at 5. That has, in fact gone down to as low as, I think it was 4.7. So, really remarkable differences for people who are normally told that these things are chronic, progressive conditions that don't improve. And, really their medications are often even more so prescribed, rather as opposed to being de-prescribed of what we're seeing here. De-prescribed by their health professionals and medical team. All of this was done in conjunction with their medical team. So please don't take yourself off medications if you're on them. That's very important. You seek medical advice. So adopting a new lifestyle. So improvements here were absolutely about an all-over lifestyle of including things like compression pumps, manual lymphatic drainage, compression garments that are really important that people with lipedema include in their everyday life. Particularly for someone who has chronic edema and lymphedema, you're going to need those compression garments. There's wraps, there's different things that you need to consider, and that has to be, daily and ongoing. Occupational therapists can help with that side of deciding, what it is that you need. So that's, something that if you haven't seen an occupational therapist, please do so, particularly ones nowadays who have the SOZO machines, because that will really help them work out, do you have chronic edema? Do you have lymphedema? And at stages of where, from stage 0, which means that you may be showing initial signs of that before it can be measured in limb size. So measuring limb size alone is not enough to really be diagnosing these things. So long-term success, this has been 2 years plus now that she has been following a ketogenic diet. So incredible results there that you can see, just amazing. But, importantly, she's now down to 65 kilos. So from 145 kilos down to 65 kilos. Her BMI is now within the healthy weight range. So that is key as well. Her pain has gone down from the 8 out of 10 to 1 out of 10. Her mobility has improved. She no longer uses a wheelchair. She can reach her feet. Her cardiopulmonary output through seeing an exercise physiologist increased by 200%, which is incredible. And of course, improved skin conditions as well, which is very important for women with lipedema and for women with lymphedema. Case study 2, this woman started at 171 kilos or 377 pounds when she started seeing me in clinic. Her BMI was 76.4, so which is morbid obesity. She was 48 at the time. She had always been overweight. She was obese since her teenage years. She was 300 pounds by her 30s, 400 pounds by her 40s. 460 pounds was her highest weight, which is what you see in this picture. And her description was she felt like she was dying. So she was diagnosed with hypothyroidism at 11 years old, depression. She had bilateral knee osteoarthritis. She was using 2 canes to walk around her apartment. She couldn't really do a lot of other walking on top of that. She was pre-diabetic. She had a chronic dry cough and nasal congestion. Throughout the intervention of a ketogenic approach, her medication has been reduced 3 times for her hypothyroidism. So still taking medication, but it has been greatly reduced. Her depression medication was stopped with her medical team. Her over-the-counter medication for pain for her knee osteoarthritis stopped. She's no longer using those canes. Her blood sugar levels are now, in the perfect sort of 4.8s, which is just incredible. She no longer has that chronic dry cough. Even that has been such a pivotal improvement in her health. And, nasal congestion not fully resolved, but still improving. So, her journey, she originally lost 30 pounds or 13 kilos just by switching to a low-carb shake. That was the only difference that she had changed. But she joined the IDM team and learned intermittent fasting, but she couldn't get into ketosis. So she came to me was still binging on different carb foods. And within 4 days of starting with me, she got into ketosis, and she was initially seeing me weekly and then moved to fortnightly and then every other month. She now still uses intermittent fasting as a regular part of her regime, and of course follows a ketogenic lifestyle and quite closely. She no longer craves junk food and finds keto easy and fulfilling. And this is, obviously really key. If keto is easy and fulfilling, it's able to be followed long term, and it's the long term, that's going to provide the key benefits. So her health markers improved significantly as well. Her triglyceride to HDL ratio decreased from 2.2 down to 1.6, which is just absolutely fantastic. And her HbA1c, of course, has decreased there from a 6 down to a 4.8. Again, just remarkable. And also importantly, her high sensitive CRP, which is a marker of inflammation, has decreased. Look at that, from an 8.2 down to a 2.5. And of course, her health journey is still ongoing. This isn't the end of the story. 2 years sounds like a long time, but it's not a long time considering how many years it took to lose your health. So to regain it, you're going to get improvements. You'll see improvements quite quickly with keto, but it's going to take time to repair, to really repair a lot. This just shows that weight loss, of just how continual it has been over that period. Now you can also see that it's not always just a downward slope, and this is important to remember as well, that weight loss, sometimes things will pop back up and then go down, and it can be all over the place, but consistently long term, and that's where we need to look at it for. It's long-term success that really, makes such a big difference. So if you were to give up, right at the beginning, when sometimes you see higher fluctuations, which could just come down to fluid retention and not even be, related to weight loss. You can't give up when you see things like that. It's the long-term perseverance that's going to help. So, that remarkable long-term success of starting, weight loss at 208 kilos, getting down to 81 kilos, such a big change. No longer craving junk food, as we said, is just an incredible part of this. So I do have a Facebook online support group. Please look that up, the Nutrition and Lifestyle Lipoedema and Lymphedema members community. So you can, I often share research and dietary and lifestyle tips in there. So I would love for you to join that. I do offer keto courses for lipedema and lymphedema. I offer quite a few of those a year. So go onto my website, ichoosehealth.com.au, to see when the next course will be starting and to register your interest. I'd love to have you be a part of the group we have different health professionals coming in, making guest appearances to talk to you about different aspects of, custom garment fitting, new scientific evidence that's evolving over time, all sorts of things, stress management techniques, building resilience, meal plans, and tons of different things. So please do check that out. Of course, I also do one-on-one consults, so you can book in for a free 20-minute discovery session to see how I can help you, and you can book in for my consult bundles as well from the website. And of course, there's some references that you can have a look at as well. So I thank you for watching that presentation. I hope that's been helpful to you. Please do head to my website and have a look at any other YouTube clips that are here that you may find successful. I'd also have a free online workshop that you can access from my website, which is on overcoming cravings and emotional eating. That's often a good place to start. And it's been great speaking with you, and goodbye and good luck.